Eisenhower Health recently made a big announcement. Effective March 1st, Marty Massiello will be its new president and CEO. I spoke with Massiello today about his new role and his priorities for the hospital. Marty, it's great to meet you. Thanks for joining us.
Thank you, Peter. I'm happy to be here.
First off, tell us a little bit about yourself and what should people know about you since you will be the new president and CEO at Eisenhower.
Well, I think a lot of people already know me in the Valley, but I'm a transplant from Chicago. I've been in the desert for almost 13 years full time. But Jeff and I have had a house here for almost 20 years. So we used to come back and forth before we moved here permanently.
And Jeff, of course, is your husband.
He is.
I know that you both have been here, you mentioned, for a very long time. What is it that you love the most about the Coachella Valley? And also, what are some of the unique healthcare challenges here?
There's so much to love about the Valley. Sunshine every day, palm trees, a beautiful community. It all adds up to just being a great place to live. And the question was about health
Challenges.
challenges. There are a lot of challenges in the Valley, obviously. We have disparate communities across the entire Valley. So at Eisenhower, we try to take care of, the whole Valley and everybody that's in it. And then, of course, the pandemic and COVID has been a real challenge for us this past year.
Yeah, certainly. And you're no stranger to Eisenhower, we should mention. You served as the COO prior to this. In your new position, what are your top priorities?
Getting through the pandemic, for sure, and making sure that we're taking care of everyone that needs us, number one. Number two is getting people vaccinated. We have a really great program going. If we can get more vaccine, that's been the problem for us most recently, and it's probably true for everybody in the county. But getting people vaccinated is one of the highest priorities. And then obviously to continue to provide the great services and clinical programs that Eisenhower has for its many years.
Do you like where the hospital stands right now overall, including financially? Do you anticipate making any major changes?
No, I think we're in really great shape right now. We've got a great board and great staff, and our physicians and nurses are incredible. So I don't anticipate making any big changes right now.
And I know you mentioned the pandemic, certainly top of mind for everyone right now. How will you be addressing the pandemic in your new role compared to what was done before?
Well, I've kind of been the person that's been in charge of the pandemic since the very beginning. So just to continue to be able to care for anybody that comes to us that needs us. And again, to really try to shepherd this vaccine program to make sure that we're getting people vaccinated so that we could get back to normal life.
Are you hopeful that things will improve soon?
I am. They're already improving. We're doing a lot better today than we were even 3 weeks ago.
Fantastic. All right. Well, Marty, it's nice to meet you. Thank you so much for joining us.
Thank you. Take care.